The founders of the Armenian American Medical Society were thinking about the needs of our Armenian physicians and caregivers in the area here, recognizing some of their needs with regards to how they connect, how they network. In addition, we've recognized that there's a need in Armenia as well, and for Armenians all around the world. This was exemplified during the 1988 earthquake in Gyumri, where many thousands of people were injured or left homeless, and there was a huge push, huge effort to send support to Armenia, and this organization came through and was able to support as well. And that allowed us to recognize our ability to perform various types of medical projects outside of the borders of the United States and to help Armenians in Armenia and Armenians elsewhere in the world.
The power of collaboration with collective stakeholders is very, very important. Unfortunately, these were during times of the armed conflict that occurred in the past few years, where through the network of and through the activities of AMIC, globally we were able to respond to what was needed.
We recognized that there was a critical component of the Armenian infrastructure that was weakened. It was a 50-year-old oxygen generator from the Soviet era in the 70s that was at end of life, and everybody kicked in. We all put our efforts together. Probably should have taken a year or two. We were able to execute in about 6 months, and we were able to deliver oxygen generation capacity that now should support the country for another 50 years.
That's just one example amongst a few.
Alzheimer's in Armenia is on the increase. Will the collaboration with AAMS help us expand our reach and develop sustainable more programs and services?
The Armenian American Medical Society is known to be very open to working with other organizations. I think this is exemplified in the Glendale Health Festival.
Our interest in this event is because Providence has always been about taking care of beyond our four walls.
The grant was $100,000. It helped us tremendously. Healing California, the last 2 years we've been collaborating. They help us with the dental and the vision.
This is the Medical Society's first time working with Medical Mission Adventures, and it's been a phenomenal partnership.
Absolutely. As we come together, we've just seen an increase in a multiplication of taking all of our giftings and potential to make this amazing event happen.
We began the Glendale Health Festival in the form that it currently is in 2010. Dr. Momjan and I showed up here before any of the workers of the facility because we couldn't sleep the night before. We needed to see things set up. Դեռ այստեղի կորձավորները չէին եկած, մենք արդեն լրիվ ամեն ինչը պատրաստած էր։ Կորձավորները որ եկան, ասեցին, բա մեր կորձը ինչ մնաց։
Glendale Spirkum met համայնքներից մեկն է, ուրեմն it's normal որ այստեղ ունենանք, այս կողմը աչքի մասնագետներն են, free vision care, check-up-ներ, dental, ինչպես տեսաք, ունենք սրտի մասնագետ, ամեն ձևի մասնագետներ կան, քաջալերում ենք, որ բոլոր հայ բժիշկները մասնակցեն այս ծրագրին։
Ամեն տարի մեր սերվիսները կավելցնենք։ Այս տարի մոտ կարծեմ 500 հիվանդներ եկան մեր մոտ։ Ինչ կարիքով օգնություն պետք ունին, այդ մասնակետի specialty բժիշկ կա, որ հարցումները պատասխանել եւ օգնել, որ ավելի առողջ կյանք ապրենք մեր հայերը։
There's a lot in common. There's a lot of great work that we do together, such as the Glendale Health Festival. Adventist Health is one of the starting partners with the Medical Society, and that's a wonderful collaboration right there, along many others that we have done together.
Հայ ամերիկյան բժշկական միությունը 40 տարվա մեջ բավականի լայնացավ, դարավ գալասել համաշխարհային կազմակերպություն եւ այդ ուժը կա եւ շարունակում է գնալ.
When we look at our Glendale Health Festival, that's very inspirational, and to see young children who are in high school or even younger coming and volunteering.
Եվ մեզ համար շատ կարևոր է Medical Society, որ երիտասարդ նոր սերունդը մասնակցի եւ հասկանան ինչը volunteer։
Քնահատելի է, չէ՞։ Շատ։ Ես միշտ իմ աշակերտներուս կքաջալերեմ, գսեմ, որ դուք ցայնն եք, ցերկաղութին։
Our children are our future, and we are going to rely on our children to continue to do the work that we're doing and to do a better job.
Pretty much since 2009, we established scholarships and strengthened our mentorship program, the two programs that go hand in hand to produce the next generation of young healthcare professionals. And our ultimate goal is for students like Rafael to turn around and themselves fund the next student.
In this journey, the only way it's possible is if you have a village behind you. But organizations like AAMS, the Armenian American Medical Society, this makes it possible for students like me to achieve the funding, the support, to achieve and realize these dreams. That's where I feel that my mission has become now. It transitioned initially from I want to go and I want to be the best possible doctor, but a big part of it now is I want to not only become the best doctor, but a community leader to help the next generation also achieve this dream as well, to help our community.
Mentorship is not just saying, oh, I gave advice, but mentorship is a relationship, a bond with a young student, and you help them get through multiple hurdles at a time.
We as an organization said, well, we want to take it to the next level. You know, we care a lot about our Armenian youth, just the way our parents and our grandparents cared about us and our success. So all the little tricks that we learned along the way, a lot of the wisdom, we try and translate it to the next generation. We also have a research program we've developed, so we help students actually launch their own research project. So everything is about trying to create the best environment for them so they succeed.
I myself joined Armenian American Medical Society because I was inspired to do something for my culture, to do something for my people. Anybody who joins the Armenian American Medical Society has access to our vast resource of medical education, has access to the ability to network on our television shows, online, as well as in person.
There are strict requirements to become CME credited society or medical organization. It was months and months of work.
The regulations, specifically in California, require that organizations that provide continuing education be accredited. So what was beautiful about this organization is that when I joined them, I found out that pharmacists can benefit.
We actually have a much broader audience in terms of multiple different specialties and allied care health physicians. It's really that diversity of the actual programming, which I think is actually so appealing. We've also tried to get a little bit more creative.
The wellness event is a fantastic addition to our portfolio of activities that we have for our membership. Physician burnout, this is a real thing. It's an issue that many people tend to stigmatize. We have to be healthy to keep our patients healthy. It's also a very fun event, more engaging, more active than our typical lecture series.
I know with a life like this, Anahit-chan, tell me how you got this position.
I wish I was a doctor's wife.
Ինչքան զույգեր կան, որ հիմա ամուսնացած են, մարդկին իրար հանդիպել են այստեղ։
AAMS-ի շրջանակը օրինակում կհիշեք անուններ։
Ամենահայտնին Ամերիկահայ բժշկության միության նախագահը
I myself,
Գանի Բասուդարյանը։
I actually met my wife at a fundraising event years ago in an organization that has connections with the medical society. It's a nice, unique way to forge a bond or to strengthen it. This is one of the beauties of being a 40-year-old organization, and I hope that my children will take example and pursue this.
Երեք զավակներս ալ future AAMS members. They're very involved with AAMS. At մտնոլորտի մեջ են, որ գլեստեն մենք ինչպես զոհված ենք մեր ժողովրդին and also for the cause.
Ինչքան մենք ցանկանում ենք մեր զավակները շարունակեն legacy, ես նաև շատ հպարտ եմ, որ ոչ միայն մեր զավակները, օրինակ ֆանդը ստեղծել scholarship եւ քաջալերել ընդհանուր բոլորին նրանք, ովքեր որ իրենց մեջ ունեն այդ ցանկությունը մասնակցելու։
Բոլորս աշխատել ենք volunteer
Ինչ որ ռինք մինչև հիմա
որքան որ հոգնեցանք, Աստված մեզի ադոր գրկնաբադի ուրախությունը տված է։
Փոխվեց։ Ատքան ուժեղացավ ասմենությունը։ I'm very proud of the Armenian Medical Society.
Ինձ համար միշտ կարևոր է որ ակտիվ լան այս օրգանիզացիոնի մեջ մեր հետ միշտ դժվար է որովհետև լսենք ինչ ըրած են անցյալին եւ ուզենք նույննել եւ ավելի լավ բաներ անել մեր համայնքի համար շատ կարևոր է միշտ ակտիվ լալը միշտ օգտակար լալը
We feel an obligation to pay it forward or pay it back, however you like to see it, to our culture and to our homeland. It's an important aspect of who we are.
We have the physicians, the nurses, the other healthcare providers, the pharmacists, who are all able to collaborate and learn from each other, which makes us all grow together.
AAMS has done so much for me and a generation of colleagues like me. It has given me the ability to all the things that I have been blessed with, that I've been also able to share and give this back to others who are in need.
Հայաստանը մեր priority-ն է։ Եվ կուզեմ ասել, մենք մեզ ոչ մեկից չենք հեռացում, բայց մեզ էլ գիտենք, մեզ հայ են ասում։ Եվ ինչու պիտի չհավարտանանք, գանք, պիտի լինենք ու դեռ շատանանք։